Hello, today we're talking from Have Your Say in our virtual format. So at home, I have guest Dr. Candace Robertson-James on the line. And as one of our public health experts, we wanted to talk to her about her feelings in reference to the coronavirus pandemic that we've been having. Wanted to talk to her about her feelings in regard to the situation, and number one, and number two, just give us a little bit of background as to what you do and how the situation relates to one of the things that you constantly talk to us about in regard to social determinants impacting the public health in different regards of health situations. And clearly this is something that's been unprecedented for us. So a little bit of background, and then tell us your overall feeling in regard to how social determinants play a part in what's been going on.
Well, thank you so very much. It's a pleasure to always be a part of the show. And yes, unfortunately, we are in the midst of a huge pandemic with the coronavirus, the COVID-19, as we're calling it. And so, yes, a little bit of background of kind of where we have found ourselves. Of course, the virus started in Wuhan, China, and throughout several months has made its way to the U.S. as well as many other countries across the entire world. And the virus is known to be spread by respiratory droplets. And so it is very contagious and easy to spread, especially amongst people who are in close contact with people who are coughing and or sneezing. It's said to believe that the virus can reach up to about 6 feet or so. So that's where that 6 foot guidance that we've heard, that for people to try to stay at least 6 feet away from each other, it's recommended, or it's believed that the virus can reach about 3 to 6 feet. And so people have been, advised to try to stay within 6 feet of one another. Because it's spread through those respiratory droplets, social isolation is kind of what we have, or social distancing is what the recommendations are. And essentially that's for a couple of reasons. Initially, because it's spread by respiratory droplets. And so it is easy for the virus to spread. So we need to wash our hands frequently. Unfortunately, we tend to touch our faces very often. And so we can touch surfaces where the virus might have been. We can come into contact with people who may have been exposed to the virus. It is thought that there are many different experiences. People have very many different experiences of the virus. And so some individuals may have mild symptoms or may even be asymptomatic. And then for other individuals, obviously it's been fatal. And so the virus has a wide spectrum of experiences as far as people are concerned. The 3 main symptoms that we've heard about are, of course, a dry cough and the fever and the shortness of breath. Those are the 3 main symptoms that have been disseminated. Of course, there are people who have had other symptoms as well, but those are the 3 predominant symptoms that have been associated with this virus. And so the social distancing has been advised largely because it's impacting so many people. And we may have heard the term flatten the curve. And that really is about minimizing the burden to our healthcare system. And so if everyone in our cities and our states was to be sick at the same time and to need to seek care from our healthcare providers at the same time, we would not have the capacity to treat everyone. And so we need to flatten that curve. We need to if everyone got sick over time, we have a better capacity to treat people. And then we have a better capacity to have people respond better to that treatment. And so we need to be able to flatten that curve. We need to obviously minimize exposure to the virus, and we need to increase the predicament of people who may have been exposed to the virus and make sure that they can get the appropriate care. And so the social distancing is really about us trying to flatten that curve and trying to make sure that we can treat as many people as possible to the best of our ability. And now, yes, most recently, there was reports a couple of days ago about racial and ethnic disparities existing within the virus, and specifically, those issues of social determinants of health always come back to get us, because they really are the foundations of health and wellness, whether we're dealing with the coronavirus or whether we're dealing with diabetes or hypertension. Those are some of the things that are continuing to impact our populations. And so what we learned is that originally we were not really looking at the data on the basis of race and ethnicity. And so recently a few cities began to look at that data and found huge racial and ethnic disparities, particularly amongst the fatalities in those cities. And so what we're beginning to see, again, we have known that the coronavirus, that people who, for whom have other conditions, other chronic conditions, and who are immunocompromised are more likely to have complications as a result of the virus. And so, unfortunately, in this country, people who are more likely to have all of those issues, have multiple chronic conditions, and or be immunocompromised, racial and ethnic minorities, those who are poor, those who live in certain environments, are much more likely to experience some of those chronic conditions. And so because of that, that inadvertently puts them at an increased risk for complications from the virus.
Okay, so certainly as president of the mainline branch NAACP, and looking at paying close attention to understanding that there are always disparities in general in a lot of areas, and how much have you seen the impact of this virus actually heighten the different disparities?
Well, certainly there are a lot of disparities. I think one of the things that I've heard said that is, I think, so true is while we are all experiencing this virus on some level, we're all in this together. And one of the first things that we can really say that we're really all in this together, we're all kind of going through this together. However, everyone is not having the same experience. And so kind of while we're all on the same boat together, we're all having very different experiences. Some of us are in coach, some of us are in first class. And so the experience that we're having on that boat is very different. And so with that being said, some people's biggest, problems or issues is that they're bored and they're tired of binge watching movies, but they're not necessarily worried about where their next meal is going to come from. Of course, other people, there have been numerous hundreds and thousands of people across the country and the world, who have lost jobs, who have been impacted economically, people who don't know where their next meal is coming from, people who don't know how they're going to continue to pay their bills, how they're going to support their families and children, people who have other medical and health conditions who don't know how they're going to continue to maintain the things that they need to do for those health conditions, people who don't have the capacity to homeschool their children or to kind of make sure that their children are being taught in the things that they need to do. Just people who are just really stressed and anxious and just, who are already struggling, who are already kind of just holding on barely, who already were kind of, had a lot of stressors, and this has really just put them over the edge. And so, our systems, we have found that our food pantries are continuing to be used, but then just the resources in the community have been utilized, and there's a continual need for people to support and advocate for our community organizations who are really trying to support our communities and individuals within our communities who really are struggling during this time.
Okay, so and as we look at those different struggles, like in watching the news every day, I mean, it's impossible to look at the TV and not seeing the reports. So one of the first reports you will hear is to how many new cases, that are as a result of the increased testing, that how many new cases are being counted, in addition to how many more deaths. So part of the thing is in looking at some of these realities, but also being very depressing when you're looking at all that's going on and people not understanding. With, as you say, those who are being impacted everybody might be impacted, but in the ways that that impact is compounded by different things. And the fact that people, once they are tested with the disease, are literally then isolated totally. And what impact is that having on people with their families or those who are actually the health professionals trying to treat them?
No, it is definitely having a huge impact on families, on our communities. One of the things that I think the messages that the public health community has tried to really get out there is that we definitely need people to practice social distancing, but how that doesn't mean isolating from people. And so we do want you to connect with people, call your loved ones and your family and your friends, send them text messages, try out a Zoom session. My children are now Zooming their friends and FaceTime. And we do want people to be connected. We do want you to check on your family and friends, check on your loved ones, check on your neighbors, but just not to physically, perhaps put them at increased risk by physically visiting them. But the blessing, one of the blessings, is that we live in an age where we have so much access to technology, and so this is definitely the time to try to put that technology into play as we definitely try to stay as connected as we can, albeit very differently and virtually. But yes, it is very, very difficult, especially for people who either are sick or in isolation, and our healthcare workers who are just, putting themselves at continued risk every day and coming home to their families as well. So just the hard work and just the bravery and the intensity that our healthcare workers continue to face every day is just tremendous. And so that's why we all have to do our parts. And so whether your part is social distancing, or whether your part is kind of, helping to treat those who are impacted by their virus, because we all, in order to get out of this, we all really do have to do our part. But also recognizing the huge pain and suffering that is going on for people who are sick. You're right, they absolutely have to be in isolation. So the best case scenarios is that they're in isolation in their homes, and can kind of be isolated off in a room or a segment of their house or their apartment, and that's really the best case scenario. Obviously, worst case scenarios, people are in isolations in the hospitals, and people, you're right, are not allowed to be visited by their family or friends, and so we are in just a very different situation, and it is very, very, very difficult. I mean, you can listen to the reports not only from healthcare providers, from family members, just the difficulty of not only going through or having a loved one with the virus, but not being able to visit them. And depending on where they are, you might not even be able to, depending on who they are, you might not even be able to talk with them or communicate with them, just depending on their situation. And so it is very, very, very difficult for people.
What are your thoughts about, as we continue to talk about the disparity, what are your thoughts about knowing, for those who don't have health insurance, for those who are in situations, let's say, they've talked about the lack of protective gear that the health professionals should be wearing. They talk about the lack of the ventilators for those who may need it. Do you have any ideas or thoughts as to how disparities might impact those who are in the hospitals and what care they may or may not get, depending upon decisions that have to be made as to who, if I've got 25 ventilators, but I have 50 people who need them, how are those choices being made? So do you have any thoughts on that?
Well, I mean, I think definitely. I think that, on some level, those decisions are terrible and very, very heart-wrenching decisions to have to be made. And definitely those are decisions that are being made every day. I think the two biggest things on the opposite side is trying to practice a social distancing and trying to help people understand the reason for it. I saw an article that said, this is not a glorified vacation day. And I think that is very true. And for some people, that's what it is. It's kind of like we're on vacation. Let's just like get all the kids together. Let's go all to the park together. Let's play basketball together. Let's do this. And you can still see in communities as you drive by, there's huge groups of people that are still, not at work perhaps, or not in a large gathering in a sanctioned way, but are still gathering, are still going back and forth to each other's houses, and are still putting people at risk and increasing that risk. And I think that the message to everybody and to every community doesn't really understand what we're doing and why we're doing it. That is for those healthcare workers. It's for the individuals who are coming, because we don't have the capacity to treat everyone. If everyone in that neighborhood or that community were to get sick, we do not have the capacity to treat everyone. And the more that we don't understand that, then we're going to have to make those hard decisions. And if those ventilators are already being used, then right, the next people who come in the door are not going to have access to those ventilators. And so we need to make sure, as well as our healthcare providers, you're right, making sure that they have access to the gear that they need to provide. Because if we don't have a health workforce, we don't have a chance. And so we have to make sure that we're protecting our health workers as well. And so this is really about us all working together and all of us really understanding why we're doing this. It's not just, it's not just because we don't personally want to get it. Yes, that's true. That's one part of it. But, really it's about flattening that curve. It's about expanding the capacity of our health workers to be able to treat every person in the community, because it's so important for us to be able to do that.
And one other group that's been interesting with the responses, for some following the directives, but for others maybe not so much, is the spiritual community, with the different churches that I just saw where I think it was in South Carolina, but one of the pastors who literally, encouraged, he had 1,200 people at a church service, and who were physically there. And so, and I guess referencing, well, faith and, God's in control. And so, therefore, we don't have anything to worry about. And so, what is your response to that?
Well, obviously this is obviously this is Easter weekend. It's Passover. These are times that have huge significance for people spiritually. And so, yes, we can all, I think, honor and pay honor to our spiritual sense and, our ability to worship and to serve God and to praise God, and for our ability to kind of reference that. But I think that, again, it's important for us all to understand that we're all in this together, that we live in a time and age where we don't have to be limited by walls, and I think one of the greatest things that I've heard from a number of preachers is that their followings have increased. And so while some people have been saying, oh, well, the church is shut down. And for many people, the church is expanding. It's wild that we've taken down the barriers, we've taken down the walls. People who haven't had access or who maybe would have never walked into one specific building are turning on services online, and being feeling more welcome than they might have if they decided to go down the street. And so there's lots of opportunities. And I think that we just have to open our minds, and we have to understand the time that we're in, and that this is very, very serious. We don't want to put our congregations and our members and our communities at risk. We want to understand who we are, and that we can really, we don't have to be minimized by our social distancing. We can be creative, and we can think differently and think out the box, and still pay honor to those things that are important to us, but in a new way. And we never know, that new way might bring us, in a different way that we wouldn't have even experienced, in our old way. And so we have to understand the difference between our traditions, as well as just our actual values, and making sure that we stay true to our values, but our traditions might need to change.
Okay. And I guess one last part is the children. How do you believe emotionally, mentally, the children are actually being able to handle the situation?
It is definitely difficult for children, and of all ages. I mean, as it has been for all of us. They were kind of uprooted in the middle of their school year. Many children just connected to their classmates, their teachers, have been at home, and again, everyone is in the same boat, but a very different experience. So some children are at home and having a great time. There's also a lot of children who depend on food, or get food from their school environment, and so not being at school also means not having reliable access to food, not having reliable access to internet to do online schooling, or for an environment that is really conducive to learning. And so our children are scared, they're anxious as well, depending on their home environment. I definitely encourage people to not have the news scrolling all day, especially if you have children. They don't need to hear the anxiety and the fear. But children are resilient, and so I think if you can, it's a great opportunity to teach children your values, and to come together and to see how, as a family, you're going to get through this crisis. And these are things that we do talk to our children about theoretically: how you're going to be brave, and how you're going to be courageous, and how you're going to help people. And this is the time that they get to practice, and you get to practice as a family. So I think that is encouraging, but recognizing again that there are many children who are in very difficult situations and don't have the support that they need, or they are disconnected from the teachers, from the mentors, from the coaches, from the people who they relied on for that social support. And now they may not have it. And so it's really just important to think about how we all can continue to, make this time something, be creative, and make this time, something that we can kind of look back on and say we were proud of how we supported each other in this time in our communities. And I've seen so many resources online, so many sites are making their products free. So many people are coming online to just read a book, or, just advocate for a specific activity. And so these are things that we can do just to continue to offer support and guidance, and think about ways our children can still learn and still grow, hopefully still, run around, get outside a little bit, even as they practice the social distancing. But it has been definitely tough. There's a lot of loss, for seniors who are graduating, and all of that. So definitely.
So from the perspective of NAACP, what would you say could be some very specific things that we could actually also do to possibly maybe be encouraging or help to direct people to certain resources, or even if we're able to provide certain things ourselves, what would those things be? And then the one thing I think that gets lost for people when I hear that they don't have the technology, or the laptops or the iPad, but a lot of them do have their phones, and then they sometimes forget as to how much you can actually access from your phone. So
definitely. Well, I think as the NAACP, I think one of the things that, can be done is to collate resources. There are a plethora of resources available right now. Like I said, so many sites have made their products free, or there's just a whole list of free sites for children on every subject, games, activities. But obviously it's overwhelming for parents to just constantly sift through. And so I think having those things available, having a collated list of resources for parents or caregivers, I think is so important. I think there's also a lot of resources for those cupboards that are, food cupboards that are available in the community, and other resources that are going to be available in the community as well. So I think that's super important, to just make that list easy and available for people to access.
Okay. And the phone itself, so
yes, and obviously to be able to use that phone to search those sites, hopefully to use your social media. There's a lot of people coming on social media to do great things. So there's you can host a session, help host a read along, but host a time to do some physical activity inside your house. Those kinds of things I think are hugely helpful. And so just remember that even if you don't have a fancy computer, you may have a phone that you can use. And we may be able, and there's lots of resources, even a lot of people who have donated laptops and computers throughout many different cities and areas. And so really being connected and find out what's available to you.
Okay. Well, any last words? Any last recommendations?
Stay healthy. I wish you to stay healthy. Stay healthy, stay safe, practice social distancing, but not social isolation.
Okay, great. Once again, it's always good to have you on our program, and we value your information and direction. And so I'm sure you will be hearing from us again because it appears that this is going to go on for a little while. But I think maybe the more we say it, the more we hear it, the more we'll be able to do what is requested, but also be encouraged to know when these numbers start to decrease and people aren't as affected as they were in the past. So as we look at how we do things, what the new norm is, let's all look at how we can have our say as part of this process. Thank you.